Hello, my name is Dr. Katie Kubera, and I am an active duty Navy orthodontist at Naval Medical Center, San Diego. Firstly, I'd like to very much thank all the OMFS residents and staff at NMCSD for a phenomenal working relationship that allows us to push the boundaries of our orthodontic cases, resulting in superb clinical outcomes. This is my patient, GB, a 24-year, 9-month-old active duty Marine who was referred to my clinic by her general dentist for orthodontic surgery. Her chief concern was, I don't like my underbite and I want straight teeth. She presented with a mesiocephalic facial pattern with roughly equal facial fifths and facial thirds. She had a straight profile with a lack of malar projection, slightly acute nasolabial angle, and a retrusive upper lip. On animation, her maxillary incisor display was approximately 50% with no gingival display. There was no lip straight-on closure. Maxillary incisor exposure to upper lip was 1 millimeter. Her maxillary midline was coincident with mid-sagittal plane. Intraorally, the patient displayed a dental class 3 molar and canine relationship, a negative 2 millimeter overjet, and a negative 15% overbite of her maxillary incisors. Her maxillary mandibular midlines were coincident. She had a symmetric, broad, and ovoid maxillary arch form with moderate crowding. Her mandibular arch was symmetric and ovoid with moderate crowding. Curva Spee was appropriate, measuring 1 millimeter, and her curva Wilson and curva Monson were excessive at her second molars, measuring 2 millimeters. Her maxillary and mandibular intermolar widths were 49 millimeters and 47 respectively. Here you can appreciate her initial models and her half-step dental class 3 molar canine relationship with anterior crossbite. Her initial panel reveals impacted maxillary third molars, missing mandibular third molars, and short roots on her maxillary first premolars. Alveolar bone heights are appropriate, and there was no caries or other gross pathology. This is her initial lateral ceph with corresponding measurements. Her analysis revealed a skeletal class 3 pattern with an A and B of negative 4 degrees, a width of negative 11 due to hyperplastic mandible. Her SNA was 81 degrees and SMB measured 85 degrees. She was normodivergent with an FMA of 25 degrees. The maxillary incisors were appropriately positioned with upper 1 to NA measuring 7 millimeters and the upper 1 to SN at 105 degrees. Her mandibular incisors were retroclined as lower 1 to NP was 83 degrees. Lower 1 to NB was appropriate, measuring 4 millimeters. Her upper lip was retrusive in relation to E-plane. Upper lip to E line measured negative 9 millimeters. 2 orthodontic surgery treatment options were presented to this patient, both with extractions of her upper eights. The first plan was the traditional approach to orthodontic surgery, entailing the leveling and aligning of her dentition prior to a single piece Laforte with inter-arch orthodontic coordination occurring post-surgically. Her second plan was the surgery-first approach to orthodontic surgery, in which a single piece Laforte would be performed first, with orthodontic leveling, aligning, and inter-arch coordination occurring post-operatively. Here is the patient's final results. Her total treatment time was 11 months. Thank you for listening, and for more details on the case, please refer to the PCSO Bulletin Summer Issue 2024.